Okay, I need you to be honest with me for a second. When was the last time you had a comfortable, easy bowel movement? Yesterday? 3 days ago? A week ago? If you're sitting there and you can't even remember, or worse, if your stomach right now feels like it's full of cement and nothing is moving, this video is for you. Constipation in adults over 60 is one of the most common and most uncomfortable health problems there is. And I mean genuinely uncomfortable. The bloating, the cramping, the feeling of pressure that just won't let up, the straining, the frustration. It can affect your mood, your sleep, your appetite, and honestly, your whole quality of life. Here's the number that stopped me cold when I first read it. Research published in the American Journal of Gastroenterology found that over 33% of adults over the age of 60 deal with chronic constipation. That's 1 in 3 people. And by the time adults reach their 80s, that number climbs even higher. But here's what frustrates me most about this topic. Most people suffer in silence. They think it's embarrassing to bring up. They reach for a laxative and hope for the best. And when things don't improve, they just accept it. They think, I'm older now. This is just how my body works. That is not true. And that is not okay. Because constipation has real, proven causes, and it has real, proven solutions, many of which work faster than you might think. Today I'm going to walk you through exactly what is happening in your gut, the most common mistakes people over 60 make that keep things stuck, and, most importantly, what you can do starting today to get things moving again, naturally and safely. So stay with me. By the end of this video, you're going to have a real plan. Let's start with a quick look at what's actually going on inside your body, because once you understand the mechanism, the solutions make complete sense. Your large intestine, your colon, has one main job: to move digested food through your body using rhythmic muscle contractions and to absorb water from that waste as it passes through. When everything is working well, this process takes somewhere between 24 and 72 hours from the time you eat something to the time it leaves your body. Doctors generally consider you constipated if you're having fewer than 3 bowel movements per week, or if your stools are hard, dry, painful, or difficult to pass. Now here's what happens as we age. The muscles in your colon slow down. Those rhythmic contractions, doctors call them motility, become weaker and less frequent. Food moves through more slowly. The longer it sits in your colon, the more water gets absorbed from it. The drier and harder it becomes. And the harder it becomes, the harder it is to push out. At the same time, the nerves in your gut that sense when it's time to go can also become less sensitive with age. So the signal that tells your brain, it's time, either comes late or comes weakly. And if you ignore that signal, even once, your body can reset to a slower rhythm. A 2018 review in Clinics in Geriatric Medicine described this as a perfect storm for constipation in older adults: slower gut movement, reduced nerve sensitivity, less physical activity, more medications, and often less fluid and fiber in the diet, all happening at the same time. The good news? Every single one of those factors can be addressed. Let's talk about how. Before we go further, I want to hear from you. How long have you been dealing with constipation? Is this something that comes and goes, or has it been a long-term struggle? Drop your answer in the comments right now. 1 word, 2 words, whatever. Years. On and off. Started after my surgery. Whatever applies to you. You'd be amazed how many people watching this video right now are going through the exact same thing and feel completely alone with it. Your comment might be the one that makes someone else feel seen today. All right, let's talk about what's making things worse, because there are several very common habits that people over 60 unknowingly do every single day that are keeping their gut locked up. And fixing these is the fastest first step. Mistake number 1, not drinking enough water. Especially in the morning, your colon needs water to keep stools soft and moving. When you're dehydrated, your colon pulls every last drop of water out of your waste to compensate, leaving behind hard, dry, impossible to pass stool. Now, here's what makes this especially tricky after 60. The thirst sensation becomes less reliable as we age. Studies show that older adults often don't feel thirsty even when they're already moderately dehydrated. So you can be significantly underhydrated and not even know it. A study published in the American Journal of Clinical Nutrition confirmed that increasing fluid intake, particularly water, significantly improved stool frequency and consistency in older adults with constipation. The fix: Start every single morning with 1 to 2 full glasses of water before you eat anything. This simple habit stimulates what's called the gastrocolic reflex, a natural wave of muscle contractions that moves through your gut when your stomach receives something in the morning. It's one of the most powerful natural triggers for a bowel movement. Mistake number 2. Eating too little fiber, or the wrong kind fiber, is the main fuel for gut movement. It adds bulk to stool, draws water in, and gives your colon something to grip and push. Without it, everything slows to a crawl. The recommended fiber intake for adults is about 25 to 30 grams per day. Research shows that most older adults are getting closer to 10 to 15 grams, less than half of what they need. But here's something important. There are 2 types of fiber, and both matter. Soluble fiber dissolves in water and forms a soft gel that makes stool easier to pass. You find it in oats, apples, beans, flax seeds, and pears. Insoluble fiber doesn't dissolve. It adds bulk and helps push waste through. You find it in whole wheat bread, vegetables, and the skins of fruits. You need both. A diet high in processed foods, white bread, cheese, and red meat, and low in fruits, vegetables, and whole grains, is one of the fastest ways to develop chronic constipation. Mistake number 3. Sitting too much. This one is a big one, and it's often overlooked. Physical movement directly stimulates gut movement. When you walk, your abdominal muscles gently massage your intestines. The rhythm of movement helps push things along. A clinical study from Scandinavian Journal of Gastroenterology found that regular walking, even just 30 minutes a day, significantly reduced constipation symptoms in sedentary older adults. When we sit for most of the day, which many older adults do, the gut has no external stimulation. Everything slows down further. Even a short walk after meals can make a meaningful difference. Mistake number 4. Ignoring the urge. This one is critical, and it causes far more problems than people realize. When your body sends you a signal that it's time to have a bowel movement, your colon is actively contracting and pushing waste toward the exit. If you ignore that signal because you're busy, you're not near a bathroom, or it's inconvenient, your colon eventually relaxes. The stool gets pushed back. More water is absorbed. It gets harder. Do this repeatedly, and your body starts to recalibrate its signals. The urge comes less frequently. The stool gets progressively more difficult to pass. The rule doctors recommend: when you feel the urge, go within 15 minutes. Don't wait. Don't finish your TV program. Go. Mistake number 5. Over-relying on stimulant laxatives. If you regularly use stimulant laxatives, the kind that force your colon to contract, without addressing the underlying cause, you can actually make things worse over time. Long-term use of these laxatives can cause your colon to become dependent on them, reducing its ability to contract on its own. This doesn't mean laxatives are never appropriate. Sometimes they are absolutely necessary and doctor recommended, but they should generally be a short-term bridge, not a permanent solution. I have to ask, because I know you're thinking it. Which of these mistakes are you making right now? Is it not drinking enough water? Not enough fiber? Sitting too much? Be honest, no judgment. Comment below. And if you've tried to fix one of these before and it didn't work, tell me about that too. I want to understand what you've already been through. Okay, now we get to the part you've been waiting for. What do you actually do when your gut shuts down? Here is a step-by-step, evidence-backed plan. Step 1. The morning routine that triggers your gut. The most powerful time to encourage a bowel movement is in the morning, and specifically, in the 30 minutes after waking up. Here's the plan. The moment you wake up, drink 1 to 2 large glasses of warm water. Warm water is particularly effective because it helps relax the muscles in your digestive tract. Some research supports adding a squeeze of lemon, as the citric acid may additionally stimulate digestion, though the water itself is the key component. Within 15 to 30 minutes of drinking, eat breakfast, even something small. Eating activates that gastrocolic reflex we talked about, which sends a wave of contractions through your entire gut. Then, about 20 to 30 minutes after eating, sit on the toilet, whether or not you feel a strong urge. This trains your body to expect a bowel movement at this time. Use a small footstool to elevate your feet about 6 to 8 inches off the ground. This position, sometimes called the squatting position, straightens the anorectal angle and makes it significantly easier to pass stool without straining. Research published in the Journal of Clinical Gastroenterology confirmed this position reduces straining and improves bowel movement completeness. Don't strain. Don't force. Just sit, relax, and let the body respond. Over several days of doing this consistently, many people find their body begins to respond naturally at this time each morning. Step 2. The fiber fix. What to eat and when increase your fiber intake gradually. This is important. Adding too much fiber too fast can cause gas and bloating. Aim to add about 5 grams of fiber per day every few days until you reach your daily goal of 25 to 30 grams. Some of the most effective high-fiber foods for constipation relief, backed by clinical evidence. Green circle prunes and prune juice. This is the gold standard for natural constipation relief. Prunes contain fiber plus a natural compound called sorbitol, which draws water into the colon and softens stool. A study in alimentary pharmacology and therapeutics found that prunes were more effective than psyllium fiber supplements for improving stool frequency and consistency. Start with 3 to 4 prunes per day or a small glass of prune juice in the morning. Green circle flax seeds. 1 to 2 tablespoons of ground flaxseed daily has strong evidence for improving constipation. Stir it into yogurt, oatmeal, or a smoothie. Always use ground flaxseed rather than whole. Whole flax seeds pass through the body largely undigested. Green circle kiwi fruit. 2 kiwis per day has been specifically studied in constipation research and found to be highly effective. A study in the American Journal of Gastroenterology found that kiwi improved bowel movement frequency, reduced straining, and improved stool consistency in adults with constipation, with benefits beginning within 4 weeks. Green circle oats. A bowl of oatmeal each morning provides soluble fiber that improves stool texture. Add some ground flaxseed and a few prunes on top, and you've built a breakfast specifically designed to get things moving. Green circle beans and lentils, among the highest fiber foods available. Even a half cup of cooked lentils provides around 8 grams of fiber. Step 3. Hydration. The right amount at the right times. Aim for 6 to 8 glasses of water per day. More if you're active or it's hot weather. Here's the timing strategy that works best for constipation. 2 glasses first thing in the morning, warm if possible. 1 to 2 glasses with each meal, 1 glass mid-morning and mid-afternoon. Remember, coffee and alcohol actually dehydrate you, so they don't count toward your fluid goal. Herbal teas, particularly peppermint tea and ginger tea, not only hydrate, but have evidence for reducing bloating and supporting gut motility. Step 4. The abdominal massage. This one sounds too simple, but the research is genuinely impressive. A technique called abdominal massage has been studied in multiple clinical trials for constipation in older adults. The results: regular abdominal massage significantly increased bowel movement frequency and reduced feelings of bloating and abdominal discomfort. Here's how to do it. Lie flat on your back. Using the palm of your hand, apply gentle but firm pressure and massage in a clockwise direction, starting from your lower right abdomen, going up toward your ribs on the right, across to the left side, then down toward your lower left abdomen, and repeat. Follow the path of your colon. Do this for 10 minutes each morning, ideally before getting out of bed. Studies using this technique saw results within 4 to 8 weeks of daily practice. Some people notice changes much sooner. Step 5. Movement. A walk after every meal. Make this a non-negotiable rule. A 10 to 15-minute walk after each meal, especially after dinner. Post-meal walking has been shown to accelerate movement through the stomach and small intestine, reducing bloating and supporting the transfer of waste into the colon. If walking isn't possible due to mobility issues, even gentle chair exercises, leg raises, torso twists, marching in place, provide some of the same benefit. Step 6. When you need a little extra help, safe options sometimes. Despite all of the above, you need additional support. Here are the options that doctors generally consider safe for older adults. Psyllium husk. Metamucil is the brand name. This is a soluble fiber supplement. A heaped teaspoon mixed in a large glass of water once or twice daily adds significant fiber to your diet. It must be taken with plenty of water to be effective. Research consistently shows psyllium improves stool frequency and consistency without dependency. Magnesium citrate or magnesium oxide supplements. Magnesium draws water into the colon and relaxes intestinal muscles. A dose of 200 to 400 milligrams at bedtime is commonly recommended for constipation. It's gentle, non-habit forming, and effective for most people. Always check with your doctor first, especially if you have kidney problems. Glycerin suppositories. For immediate relief of hard, impacted stool, glycerin suppositories act locally in the rectum and typically produce results within 30 minutes. They do not enter the bloodstream and are generally considered very safe for short-term use. I want to check in with you. Is there a specific strategy here that you haven't tried yet, or one you've heard before but couldn't stick with? Tell me in the comments. Because here's the thing, knowing what to do is one thing. Actually doing it consistently is another. And if there's something getting in the way, a practical obstacle, a medication issue, a mobility problem, I want to hear it. Your questions shape the videos I make next. I need to spend a few minutes on something that affects a huge number of older adults and is almost never discussed in everyday conversation. Medications are one of the leading causes of constipation in adults over 60. The list of common medications that cause or worsen constipation is long. The most significant offenders include opioid pain medications, codeine, tramadol, oxycodone. These are notorious for causing severe constipation, as they directly slow gut movement. Calcium channel blockers, a type of blood pressure medication. Iron supplements, very commonly prescribed for anemia. Antacids containing aluminum or calcium. Many people take these daily without realizing the constipating effect. Certain antidepressants, particularly older tricyclic antidepressants. Antihistamines, including some common allergy medications. Diuretics, which can cause dehydration and indirectly contribute to constipation. If you've recently started a new medication and noticed your gut has slowed down significantly, that is not a coincidence. Please talk to your doctor. In many cases, there are alternative medications available or dosage adjustments that can help, or specific medications designed to counter this side effect. Do not stop any prescribed medication without talking to your doctor first, but do have the conversation. This is your quality of life, and you deserve to have it addressed. Most of the time, constipation is a functional problem, meaning it's related to diet, hydration, activity, and habits. But occasionally, it can signal something that needs medical attention. Please see your doctor promptly if you experience constipation that has come on suddenly with no clear cause, especially if you're over 60 and this is new blood in your stool or on the toilet paper. This should never be ignored. Unexplained weight loss alongside changes in bowel habits, severe abdominal pain, or cramping. Constipation alternating with diarrhea. This pattern should always be evaluated. Stool that looks pencil thin consistently. This can sometimes indicate a structural problem. Constipation lasting more than 3 weeks that isn't responding to lifestyle changes. These symptoms don't automatically mean something serious is wrong, but they do need to be checked out. Catching something early is always better. Don't let embarrassment get in the way of an important conversation with your doctor. Let me pull everything together into one simple daily routine you can start as early as tomorrow morning. Upon waking, white heavy checkmark. Drink 1 to 2 glasses of warm water immediately. White heavy checkmark. Do 10 minutes of abdominal massage in bed. Breakfast. White heavy checkmark. Eat within 30 minutes of waking. Oatmeal with ground flaxseed and prunes is ideal. White heavy checkmark. 20 to 30 minutes after eating. Sit on the toilet with feet elevated on a footstool. White heavy checkmark. Stay relaxed. Don't force. Give it 5 to 10 minutes through the day. White heavy checkmark. Drink 6 to 8 glasses of water. Spread throughout the day. White heavy checkmark. Take a 10 to 15-minute walk after each meal. White heavy checkmark. Respond to any urge to go within 15 minutes. Never ignore it. Evening. White heavy checkmark. Have a fiber-rich dinner. Vegetables, beans, whole grains. White heavy checkmark. Consider magnesium citrate. 200 to 400 milligrams. At bedtime if recommended by your doctor. White heavy checkmark. Avoid heavy, processed, or high-fat meals late in the evening every week. White heavy checkmark. Review how many days you had a comfortable bowel movement. White heavy checkmark. Adjust fiber and fluid intake based on your body's response. White heavy checkmark. Keep a simple log if it helps you spot patterns. Listen, I know constipation isn't exactly a dinner table conversation. It's not the kind of thing most people feel comfortable talking about, even with their doctor. But it is affecting your daily life. It is affecting how you feel, and you deserve to feel better. The strategies in this video are not guesses. They are backed by clinical research. They have helped thousands of older adults get their gut moving again without relying on medications. And they can work for you too. Start with just one thing tonight. Drink an extra glass of water. Set your alarm 10 minutes earlier tomorrow to try the morning routine. Buy a bag of prunes. Pick one thing and do it. Small, consistent changes produce real, lasting results. If this video gave you even one useful idea, please hit that thumbs up button. It takes 1 second, and it helps this video reach another senior who needs this information right now. And subscribe if you haven't already, because every week we're covering the real health topics that matter most to people over 60, based on what the science actually says, in language that actually makes sense. And please, leave a comment. Tell me what you're going to try first. Tell me what's worked for you before. Ask me anything. I am here. I read every comment, and I will respond. You are not stuck with this. Your gut can move again, and it will. I'll see you in the next video. Take good care of yourself.